Good afternoon, everyone, and uh, today's topic is antiprotozoal drugs. And uh, protozoal diseases are common in underdeveloped countries because the hygiene is not as good there, and also the vector uh, mm, transmission is not controlled uh, and usually these are tropic and subtropic countries, and because the protozoa are the closer to the human, it is harder to treat the disease as the protozoa are also eukaryotic. Besides there being a unicellular or organism, they have many common features with the human cells, and that is why the antiprotozoal drugs have uh, more side effects and also more toxic for the human organism. Besides, most of them are teratogenic, and that is why completely contraindicated for the pregnant woman. And the uh, the classification includes drugs for the treatment of about 5 diseases, and uh, that include amoebiasis, that is uh, developed by the Entamoeba histolytica, and for the amoebiasis, mostly uh, chloroquine is used, but also metronidazole. Then malaria is uh, common in African countries, India, and other tropical countries, and less common in Europe and American countries. So mefloquine is usually a drug of choice, and trypanosoma is common in Latin America and America, so this mostly American disease, uh, and um, leishmaniasis and toxoplasmosis and giardiasis are less common diseases, but still uh, there are places in Africa where toxoplasmosis is very common, and for giardiasis also in Latin America, and leishmaniasis is less common. So these are the classification of the drugs, and we will start with amoebiasis. And amoebiasis, also called a dysentery. Dysentery is common in children, and it caused by the Entamoeba histolytica. Histolytica means that it uh, will dissolve the tissues, and the disease can be acute or chronic, and symptoms can be diarrhea, or, or very, it can be less or more uh, developed in the patient, and the diagnosis is done by microbiological tests from feces, and uh, the treatment is uh, uh, indicated for both the acute and chronic infection. So, and the life cycle of the intermembrane histolytica is presented on this slide. This is the cyst that usually ingested by the water or food, because people forget to wash their hands, mostly children, and then this will go to the stomach, and in the ileum it will make trophozoites, and these trophozoites will dissolve the wall of the intestine wall and enter the blood, and then with the blood it goes to the liver, and then uh, lives in the liver. So, and then spread it to all other parts of the body, and then the remaining cysts will be released with the poop. So the trophozoals are non-infective, but the cysts are infective. So that is why you should wash your hands after you visit the toilet. So depending on the site of the infection, the different drugs are used, and for the luminal for the luminal amoebiasis, the aromamycin and iodoquinol are effective, and then for the systemic amoebiasis, the chloroquine and the hydroamycin are used, and then for the mixed amoebiasis, the metronidazole and tinidazole azole derivatives are effective. So this is the uh, life cycle of the intermembrane histolytica, and the uh, mixed amoebiasis metronidazole is actually a derivative of nitroimidazole, is the drug of choice for the for the treating of amoebiasis, and metronidazole is very effective, and is also effective against the Georgia lamblia, that we'll discuss shorter later, and also effective against some bacterial infections, including the Trichomonas vaginalis and some Bacteroides species. And of course, also for the treatment of the Pseudomonas pseudomembranous diseases caused by the Clostridium difficile. So because it's resistant for other antibiotics. The amoebas produce uh, the uh, the ferredoxin-like low redox potential that participate in the metabolic pathway, and the metronidazole is able to act as an electron acceptor, forming the reduction cytotoxic compounds, and that will bind to the DNA and then result in the death of these blue trophozoites. So, uh, metronidazole is administered orally, and uh, usually it's administered with the luminal amylicides like paromomycin and iodoquinone because it's less effective in the lumen. After it's absorbed, the concentration is low in the lumen. That is why luminal amylicides are usually combined, and combination is much more effective for the treatment, like 90% effective, and the uh, the adverse effects include the nausea, vomiting, and GI disturbances, and also metabolic tastes. So metabolic taste is usually not a problem. We should just remind the patient GI disturbances and nausea, vomiting are very common, uh, and that is why also should not be used with an alcohol because of the disulfiram-like reaction may occur, and uh, and there is a derivative of the metronidazole that is called tinidazole. Tini is like a tiny metronidazole, so tinidazole is actually a new drug and has better uh, absorption, less adverse effects, and it has the same efficiency as the metronidazole, but also it's more expensive. Of course, the same so the tinidazole also has a disulfiram-like effect. So despite being expensive, patients should not use it with alcohol. So after the treatment of the luminal and systemic intermediate histolytica is complete, uh, 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 so the luminal agent should be used to for the treatment of the colonization stage. So these drugs include the iodoquinone and paromomycin, and uh, iodoquinone it is effective against the cyst
Hello.
trophozoites, and adverse effects of include diarrhea and neuropathy, including the optic neuritis, and that is why it should not be administered for a long time. Paromomycin is an aminoglycosidic antibiotic. It is only effective against the luminal forms, uh, and it has less side effects, systemic side effects, because it's not absorbed from the GI, and the uh, and these drugs are also used against the uh, giardiasis and other protozoal diseases. Adverse effects usually GI only. So then the third group of drugs is systemic amybicides. These drugs are uh, uh, used for the treating of liver abscesses and include the chloroquine. Chloroquine is a combination of the so usually used in combination with the metronidazole, and it will be effective against the trophozoals and liver abscesses, but is not useful for the luminal amebiasis. And also the therapy should be followed by the luminal amebicide like the metronidazole. And then the hydroemetine is a second is an alternative for the chloroquine, and dihydroemetine is the protein synthesis inhibitor and injected intramuscularly, and it is very toxic, and that is why usually not used unless there is a resistance to the metronidazole. Adverse effects are the same: nausea, vomiting, also the dizziness, neuromuscular weakness, and cardiotoxicity. So these are the three groups of the drugs used for the treatment of amebiasis. And so the next disease is malaria, and the malaria is an acute infectious disease caused by the plasmodium. So plasmodium is not the only, there are different species of the plasmodium, but they all are transmitted by the female Anopheles mosquito. So and it's very common in the Africa. So when you arrive in Africa, there is a malaria prevention program that will give you a net or a sleeping net. So you will put that net above your bed for the night to prevent mosquito biting you while you are sleeping. So this, and they give you the one net for free. So then you have to wash it and then use it for a long time, or to buy a new one. So, but most people in Africa are poor to buy a new. That is why they use it and wash it. So there are different types of the plasmodium. So the most dangerous is Plasmodium falciparum. Falciparum means the finger-like, and because it will lead to the acute disease with the high fever, with the orthostatic hypotension, and massive erythrocytosis. And then can lead to the death in 48 hours. So the one moment. And the that disease requires prompt treatment. The second one is Plasmodium vivax, that is less toxic, and then Plasmodium malaria is very common, and Plasmodium ovale is less common. So and the mosquitoes so the one of the ways to prevent the disease is using insecticides against mosquito, but the bad news is that mosquito now is resistant to the insecticides, and also the plasmodium species are type all plasmodium species are now resistant to the drugs, especially plasmodium falciparum. So, and this is life cycle of the Plasmodium falciparum, and the life cycle begins from the uh, biting of the mosquito that is infected with the trophozoites. Then the trophozoites, the sporozoites will enter the blood, and they go to the liver, where they make a metazoids. So one trophozoite will make a large amount of the metazoids. Then metazoids are released to the blood, and then they go inside the red blood cells. So red blood cells, uh, in red blood cells, uh, they develop to the trophozoite, and the trophozoite they multiply, and then uh, the uh, the trophozoites uh, will make new metazoids, and then uh, so we have now returning to the metazoids that was previous, but there are much more metazoids now, and then these metazoids are released when the uh, erythrocytes are ruptured, and they infect other erythrocytes. So this is a in geometrical uh, increase, and then some metazoids can become gametocytes, and when the female mosquito sucks the blood from the human that is infected, then uh, these gametocytes go to the body of the mosquito, where uh, the sexual reproduction of the uh, plasmodium occurs, and will form a new sporozoids, and then that mosquito will bite another human that is not infected, and then the cycle will repeat. So this is actually the non-sexual reproduction of the um, plasmodium. So the human is the that is why, and this plasmodium is asymptomatic in mosquitoes, so it will not uh, damage the mosquito, because the sexual reproduction occurs in mosquito, but that will not completely asymptomatic, and will not lead to the death of the mosquito. So because they spread the disease, so uh, uh, it's not good thing to kill the one that help you to transfer to another to survive. So the drugs include the uh, primacine, and primaquine is a 8-aminoquinolone, is administered orally, and um, the primaquine uh, uh, is uh, acts on the erythrocytic forms, Uh, so it acts on exoerythrocytic forms, uh, and the the gametocytic forms are destroyed. Uh, then, because the gametocytic forms are destroyed, including that are in mosquito, then it's very effective, um, and also for the prevent the spread of the disease. The mechanism of action is not completely understood, and the uh, in the human body, the metronidazole will destroy the schizons, um, and also it destroys the erythrocytes before they will rupture and spread the gametocytes and merozoites. So uh, its uh, adverse effects include the hemolytic anemia, so it's connected to the mechanism of action, especially in the patients with the deficiency of the glucose 6-phosphate dehydrogenase. So uh, this enzyme is used in the metabolic processes that you should learn at the biochemistry, uh, and usually the uh, it leads to the methemoglobinemia, and it's contraindicated during pregnancy. Uh, the second drug is chloroquine. Chloroquine is a synthetic aminoquinolone that has been used as an antimalarial, but uh, there are resistance. Most plasmodium are resistant now. That is, and it is less effective. And chloroquine is specific for the asexual form of plasmodium, uh, and usually used for the prophylaxis of the malaria for those who travel to tropical countries, and also is used for the treatment of amoebiasis, as we discussed uh, several minutes before. So the mechanism of action is also not understood. So and the is administered orally, and the uh, chloroquine penetrates the central nervous system and placenta. That is why contraindicated in pregnancy, uh, and the it is assumed that chloroquine uh, prevents the uh, so for the um, it prevents the cycle of the in the parasite, uh, because the plasmodium will use hemoglobin for the synthesis of the amino acids, and the Globin, like hemoglobin has two parts, hem and globin. Globin is the protein that has amino acids that are useful for the plasmodium, but hem is not useful. So that's why hem is uh, released and it's toxic for the plasmodium. And that is why the plasmodium will use the uh, polymerases that are enzymes that make a hemazine from the hem that is non-toxic, and then it will be released with the vacuole outside to prevent the toxic effect. But the chloroquine inhibit these polymerases and hem accumulates, and then uh, that results in the death of the plasmodium and the death of the erythrocytes. So this is proposed mechanism of action, but we're not sure about that. Adverse effects include GI disturbances, headaches, blurred vision, and that is why usually the patient should be examined for the vision with the ophthalmologist, uh, and then discoloration of the nail beds and mucous membranes may occur if used for a long time. And it's contraindicated in patients with psoriasis and porphyria uh, because they can lead to the acute psoriasis, and is also prolonging QT interval and lead to the potentially fatal arrhythmia should be avoided with the other drugs that lead to the QT prolongation. And in most parts of the Africa, Asia, the chloroquine is not effective because of the resistance, uh, and that is why the atovaquone proguanil combination is used, that is effective for chloroquine resistant stains of Plasmodium falciparum, and then mefloquine is also effective against the resistant stains and is used for prophylaxis mostly, but also for the treatment. Mefloquine is not available in most non-African, non-malarial countries. Uh, so, but there is also resistance. And mefloquine has a long half-life, uh, but adverse effects um, are not variable and include the dizziness, disorientation, hallucinations, and depression, and also the nausea vomiting standard for the all antiprotozoal drugs. But the depression is very severe, so for the prophylaxis, mefloquine is should be used for about 1 month before the travel to the uh, to the tropical country, and then during the whole period of travel, and then 2 months after, so that is 3 months plus the duration of the travel. For example, if you travel for 2 weeks only, that's for the vacation, then you have to use it for the 3.5 months. That is very expensive drug, and then the adverse effects are very severe. And quinine, uh, quinine is actually a plant, mm, plant drug that is isolated from the bark of the cinchona tree, and the uh, it is killing the erythrocytic form of the plasmodium, and are usually only used when other drugs are not effective, because it's uh, it's very has so many side effects, including nausea, vomiting, and central side effects like vertigo, and uh, usually they are not as severe, but sometimes the hemolytic anemia may occur that requires drug discontinuation. Uh, uh, and also uh, the quinine should not be administered with the aluminum containing antacids that prevents the absorption. And the last one is the artemisinin. Artemisinin is also derived from the plants, and it derived from the Artemisia absinthium, that is a sweet wormwood plant, and it has been used in Chinese medicine for many centuries, and also it was used in Vietnam during the Vietnam War, uh, because it was in tropics, and many soldiers were dying from the malaria, uh, and the Vietnam was has been using it for many years, and they have artemisinin that has no resistance, and the American soldiers were using the chloroquine, uh, that Plasmodium developed resistance to, and that is why American soldiers were dying more from the malaria, and then Vietnamese soldiers, so that is why they cannot actually uh, uh, cannot get a victory, because they died from the malaria more, and other actually diseases. And then later the Chinese scientists published an article about the artemisinin, uh, and the whole world were starting to use it, but before it was secret drug that uh, was kept secret because by the Chinese government. So and further, the derivatives of the artemisinin were developed as the drugs, and this includes the uh, lumefantrine and artesunate, and sometimes they are combined with the mefloquine and chloroquine, and the uh, the drugs can be taken orally, intravenously, or rectal, and adverse effects include the nausea, vomiting, and diarrhea. Then the pyrimethamine uh, uh, acting on the schizont, uh, and uh, it can be used as uh, the, for the treatment of the Plasmodium falciparum, and it can be used solo or in combination with the sulfadoxine. Uh, and it's also used for the toxoplasmosis. So these are the drugs for the malaria, and usually combinations are used to prevent the development of resistance. So the most common adverse effects include GI disturbances, rash, headache, and blood vision. So the next disease is trypanosomiasis, and there are two types, African and American. African trypanosomiasis is called sleeping sickness, and is transferred by the tsetse or fly that bites the animal, and usually it falls asleep because of the central nervous system uh, uh, it's called central nervous system uh, inhibition. And then there is an American trypanosomiasis that is called Chaga disease after the uh, Latin American physician, uh, and both diseases are chronic and eventually lead to the death unless treated. And the disease is caused by the trypanosoma, and there are the African trypanosomiasis, that is sleeping sickness, is caused by the Trypanosoma brucei gambiense, and uh, the also the brucei Trypanosoma brucei rhodiense, and these are central nervous system diseases. And the American trypanosomiasis or Chaga disease is caused by the Trypanosoma cruzi, like Tom Cruise. So it's usually in South America, and uh, the uh, there are several drugs that are used for the treatment, and the pentamidine is uh, active against the African trypanosomiasis developed by the Trypanosoma brucei gambiense and rhodiense, uh, and pentamidine is used for the treatment of the uh, hemolytic stage, that is without the central nervous system involvement, uh, and is also used for the prophylaxis. Uh, The uh, the mechanism of action is not known completely, but it destroys the DNA or RNA. Is administered pentamidine is administered intramuscularly or intravenously, uh, and it is not effective against the central nervous system because it's not penetrating the central the uh, central nervous system, and side effects include the uh, hypotension, hypoglycemia, and diabetes. So the next drug is suramine. Suramine is used uh, in the beginning of the disease, also for the trypanosomas brucei, and uh, uh, it must be injected intravenously, and also does not penetrate the blood-brain barrier. Elimination half-life is long, and adverse effects include nausea and vomiting. The next drug is uh, melarsoprol. Melarsoprol is arsenical compound and is used for the treatment of the central nervous system disease of the trypanosomiasis, and it is the only drug available for the trypanosomiasis brucei, and the mechanism of action is connected with the reaction of the sulfhydryl groups of enzymes, and the uh, and it's administered with a slow intravenous injection and is very toxic for the central nervous system. Uh, Hemolytic anemia is seen for the patients with the glucose 6-phosphate dehydrogenase deficiency, like with the quinine, and adverse effects include the hypertension and neuropathy. Then uh, eflornithine is an inhibitor of the ornithine decarboxylase. It's another enzyme uh, that uh, uh, that produces the polyamides in the toxoplasmol, and this stops the cell division and injected intravenously. It's used for the treatment of the trypanosome brucei gambiense, and uh, is less toxic than the previous drug. It also has adverse effects like anemia and hearing loss, but it is reversed after discontinuation. Then the next drug is nifurtimox. Nifurtimox is used in the treatment of the trypanosome cruzi infections or Chaga disease. So it's uh, American trypanosome, and mechanism uh, the mechanism of action uh, based on the reduction and generating of intercellular oxygen radicals, uh, and these that are toxic for the Trypanosoma cruzi, uh, so and then they lead to the cell death. But the human host cells have enzymes that uh, protect from these intermediates, and then they make water from them that include the catalyses, glutathione peroxidase, and superoxidase dismutase. So these enzymes are only present in human cells. That is why we see that this cell will die and this cell will live. So, and then there is a benzimidazole. Benzimidazole is also like a metronidazole is a nitroimidazole derivative with the same mechanism of action as in the previous drug, and it's better tolerated and used for the treatment of Chaga disease. The adverse effects include insomnia, anorexia, and neuropathy, also some dermatitis. So the next disease is the leishmaniasis. There are three types: cutaneous, mucocutaneous, and visceral. Um, and Leishmaniasis are transmitted from animals by the bite of the sandflies. The diagnosis is established uh, uh, by the uh, by the leishmania in the uh, in the biopsy, and the treatment is amphotericin B that we discussed in previous classes, and also sodium cibogluconate with pentamidine and paramomycin can be used. Miltefosine is also administered orally. All previous drugs are intravenous, and the the choice of the drug depends on the species of leishmania. So the sodium stibogluconate is uh, uh, it's not well absorbed after oral administration. That is why it's injected intramuscularly, and adverse effects usually are minimal, include the pain in the site of injection and also GI disturbances and arrhythmias. Uh, and miltefosine is first oral drug used for the treatment of visceral leishmaniasis, uh, and not used for the cutaneous and mucocutaneous forms. The mechanism of action is also not known, and The drug is contraindicated during pregnancy because it's teratogenic and nausea vomiting, same as most of the antiprotozoal drugs. Then the next disease is toxoplasmosis. Uh, Toxoplasmosis is caused by the Toxoplasmosis gondii, usually transmitted by the uncooked meat, and then in pregnant women it can be transmitted to the fetus. And the only animals that shreds oocytes are cats. Uh, Cats will infect uh, people and other animals, and that is why in France, where they uh, like uncooked meat that is considered a uh, delicate dish, so it's very delicious, and many restaurants will serve raw meat, half-cooked raw meat of the uh, horses, and it's very tasty. But unfortunately, uh, uh, it's, uh, it's, it's sometimes it can be infected by the uh, toxoplasmosis, and uh, to prevent that, the pregnant women should not eat that meat, and also it's not recommended to uh, for the pregnant woman to live in the house where there is a cat or it has been for any time in that house. So because if the cat will live in the house, it will cover every shelf with the oocytes. It's not possible to clean it because oocytes are very resistant for the cleaning and disinfectants. So there is no effective disinfectant against oocytes. So I know the one scientist that tried to develop a disinfectant for the oocytes of the Toxoplasma, and he failed. So he tried every substance in the world, but they all were resistant to that. So that is why I uh, never uh, adopt a cat in the house if you plan mm, to plan the babies. So uh, cats are very cute, but they uh, they release all sides of toxoplasmosis. So the treatment is the uh, combination of sulfadiazine and pyrimethamine. Also, leucovorin can be uh, administered to reduce the deficiency in folic acid. Uh, and the last one is the uh, giardiasis caused by the Giardia lamblia. So this is the life cycle of the Giardia lamblia. Is intestinal parasite, and it has two life cycle stages in the trophozoite with four flagella and the drug-resistant cyst. So ingestion is usually from the drinking water, and then trophozoites are exit in the small intestine and divided by the fusion, and then occasionally the cysts are formed and that pass out in stool. Uh, some infections are asymptomatic. The diarrhea can occur. The metronidazole 5 days is the treatment of first line treatment, and alternative is the tinidazole with the same efficiency because they have the same efficiency. The, then uh, the tinidazole is also orally, one dose only. Uh, uh, the albendazole, that is actually antiemetic, also can be used, and sometimes paromomycin also, especially in the pregnant woman. So these are actually all the drugs and diseases. Any questions?
No, sir, it's clear.
All clear. So I'm glad that all clear. So this is actually the last lecture. Uh, so beginning from the next week, we don't have lectures. So we will start directly with the practice. Practice will begin at 3 o'clock. So uh, thank you for attending the lecture. Please
Thank you, sir.
stay for the practice.
Okay.
Practice. What we will have. Do you want the practices